Prostate Cancer by Julia, Maddie, and Cassandra. Meet Anthony. Anthony is a 70-year-old man who works as an accountant. He doesn't get much exercise and has a poor diet. Lately, Anthony has noticed that he has been urinating frequently, especially at night. He also noticed uncontrolled dribbles throughout the day. One day, while voiding the bladder, Anthony saw blood in his urine. He remembered that his father, who had passed away from prostate cancer, went through the same symptoms. He decided to go to the doctor and get it checked out.
Let's have a look at the risk factors.
Age. Around 60% of prostate cancer occurs in men over the age of 65. Ethnicity. Prostate cancer is more prevalent in African American men and least prevalent in Asian and Latino men. Geography. Prostate cancer is more common in North America, Europe, and Australia. It is less common in Africa and Asia. Family history. Prostate cancer runs in families throughout generations, which shows that there is a genetic link to the cancer. However, most men who are diagnosed with prostate cancer acquire it from a factor other than genetics. Gene factors. Linked closely to family history, there are a number of genes that can cause prostate cancer, including inherited genes and acquired genes. Mutated genes BRCA2 can be inherited and are likely to cause prostate cancer. RNASEL is another gene that can become mutated. There are some other risk factors that are related to prostate cancer to a lesser extent, including diet, smoking, chemical exposures, and sexually transmitted infections.
Before we jump in, let's talk about the normal anatomy. The prostate is part of a man's reproductive and urinary systems and is located between the bladder and the penis and in front of the rectum. It surrounds the base of the bladder and is composed of two lobes that surround the urethra. The urethra runs through the center of the prostate gland, enabling urine to leave the body. The prostate is made up of three zones: the peripheral zone, the transition zone, and the central zone. The prostate gland produces a nourishing fluid that is ejaculated along with the sperm. The prostate is also partially responsible for controlling urine flow. Its muscle fibers wrap around the urethra and contract to slow or stop the flow of urine. Let's compare a healthy prostate and a cancerous prostate.
A normal prostate is about the size of a walnut and does not cause strain or pressure on the urethra or bladder. In a cancerous prostate, the tumor enlarges the prostate, compressing the urethra and bladder, making it harder to pee and increasing the need to urinate.
Let's have a look at the physiological processes.
In older men, the prostate cells have been exposed to many different risk factors over time, which increases their risk of becoming mutated. Once a cell becomes mutated, it begins to divide, creating a slow, continuous growth of cancer cells, eventually forming a cancerous mass. The androgens testosterone and dihydrotestosterone stimulate cell growth. Because cancer cells are resistant to apoptosis, they can continuously progress. As the mass spreads throughout the regions of the prostate, swelling occurs, constricting the urethra and the ejaculatory duct. Eventually, the mass will spread to the regional lymph nodes and nearby organs.
Let's see how that affects our key concepts. In normal prostate epithelium, cell proliferation is low and is balanced by a low rate of apoptosis. Cell proliferation is greatly increased in prostate cancer, and apoptosis is decreased by 60%. This alteration in cell cycle homeostasis plays a role in the progression of this disease. Prostate-specific antigen, PSA, is a protein that is produced by the cells of the prostate gland, which can be used to screen for prostate cancer. High levels of PSA found in the serum can indicate if an individual has prostate cancer.
Cell membrane. Prostate-specific membrane antigen, PSMA, is a glycoprotein that is embedded in cell membranes of prostate cells. It is increased in the cell membranes of cancerous prostate cells, and it can be used as a marker for therapeutic agents such as cytotoxins.
Treatments include surgery, radiation, hormone and cryotherapy, vaccine treatment, and bone-directed treatment.
In 2014, scientists published a study which demonstrated the ability of boron to selectively inhibit the growth of prostate cancer cells while still allowing the growth of normal prostate cells.
Luckily, Anthony caught his prostate cancer early and his PSA levels will be monitored. Remember, gentlemen, the earlier cancer is detected, the earlier it can be treated.
Created using Powtoon.